The next question is, how has the issue of determining how to compare interpreters' skill levels with old certifications versus new certifications? And then it says under that, does CICT equal NIC?
Is that for me? Again, I don't know the answer, but I know the process, okay? And the process is that you first define the new skill. What is it that this new credential represents? And then you ask the question, what evidence is there that someone who had this other credential does or does not have that skill set? Do you see what I mean? So keep in mind, let's say we have 2 levels, NIC 1, NIC 2. It may be that some of the old credentials, you would say, yeah, these people were tested in this content area, they've had continuing education, they've practiced their profession for this number of years. That criteria equates to NIC 2. Or you might say that criteria equates to NIC 1. But you understand what you're doing. You're assessing, again. You're looking at what their skill set really is and what evidence you have. So you can make a confident decision as to where they belong in the new structure, okay? So we don't know the answer, but that's the process. Now, in order to do that, we first have to get all these things defined for the new format. We have to understand what NIC 1 means, NIC 2 means, and specialties. It may be that some of these old tests, or old credentials, excuse me, will translate to a specialty, or they may translate to one of the 2 generalist levels. I don't know. We will need to actually study, look at the information, the evidence, and make a decision based on that evidence and information.
And if I could just add, the question was posed to me, and while I don't have the ability to answer it because I wasn't involved with the task force, I feel confident in the task force members to make the decision to move forward. And if they had come to the board and reported to us that the test is invalid, I would have no problem reporting that to you today. That was not their findings.
Thank you both. Next question. Renaming the test makes it look like RID wants to create a new distinct product rather than to refine their designated product certification. I am concerned that having bought into the NIC, you now bring along yet another label. Changing the label just opens us up to more us's and them's behaviors. Us and them behaviors. So there's then there's a diagram. CSC, arrow, CICT, arrow, NIC/A/M, arrow, NIC1/2, arrow to a box that says RID certified for all of these. And then below that, if you must, leave it NIC, NICA, or advanced.
We haven't defined labels yet, okay? All we've said is that there's 2 levels, at least 2 levels. And this becomes a communications issue. Remember I talked about truth in advertising. You want to communicate to people what they're going to get when they hire a person with this credential. It doesn't matter to me what the label is, as long as it's clear and truthful. So if it is that we can use the old labels and people are more comfortable and we simply define them, perfectly fine. If, on the other hand, in order to define them clearly, RID needs to adopt new labels, then they should do that. So again, this is a slightly different issue. It's not necessarily a testing issue. It's more, again, truth in advertising kind of issue, and how you can communicate to people what they're really getting when they hire this person. That's where value comes in. If you don't have value, if you don't have understanding, if you don't have, I'm delivering you a toaster that can make toast, then all of this is for naught. Because if you don't have value, then no one respects the credential, and there's no reason to even have it.
Okay, we have two more questions. One is, when can we see the definition you mentioned earlier in regards to the generalist NIC1? Another question, estimated cost. And then on the back, why not just call us all NC, meaning nationally certified?
Okay, let's break them down. We need to finish the NIC1 needs to be finished before we can release what that definition is. But that we have a working definition. It needs to be tweaked a little bit. My guess would be with the launch of the new examination, the new NIC1, with that will come the communication as to what that means. Right now, keep in mind that we're not releasing NIC1. We're simply saying the current NIC. So whatever that meant in the past is what it continues to mean. The cost, it depends. I mean, we have a lot of things to look at. We've got to go through a number of steps to create cost estimates and make sure that we're doing things in the most efficient, cost-effective manner. So we don't have a total cost yet to communicate. Obviously, that has to be communicated to the board. The board has to approve that, and it has to fit into the budget. And what was the third question?
Why not just call us all NC, nationally certified?
Okay. You could do that if you felt that that was communicating what you thought the industry wanted and needed to be able to make decisions. What I heard from the task force was that the problem you have today is that the industry doesn't know what they're getting, that they need to clearly understand, when I hire this person, I'm going to get this skill set. If you determine that you only needed one skill set, like architecture, there's only one. If that was fine, then you should do that. That's the most simple solution. If, on the other hand, you say, no, I might want to hire an NIC1 for these tasks, but if I know I need someone who has more skill, I should be able to identify that person. There should be some classification. If there is value associated with it other than interviewing people and doing things. For example, when people hire architects, they go through a fairly lengthy interview process where they look at their work that they've done and all this sort of thing, and they make a determination as to whether they've achieved this higher level. I don't know that you have the time in your industry to do that, but it's up to you. If you felt that the profession, the consumer, was being well served with one credential, just have one. If, on the other hand, you believe, as the task force stated, that they felt they really had to understand what they were going to get, that they needed to be able to determine, I need a 2 or I need a specialist to do the job, then have that. Meet the demand of the industry, basically.
Okay, there are 3 questions left. This one has an answer from, I assume, from Farah.
Oh, good.
Can we get a copy of this presentation and the Q&A to bring back accurate info to the community of interpreters who could not be in this session? And the answer is yes. Everything will be available on rid.org and in the click link for NIC News. You're welcome. It was easy. Thank you, Farah. I came in with an open mind, and I like most of the content. However, these lengthy answers feel like we're being stonewalled to not answer other questions. My frustration level now with this meeting and process is extreme. We have questions with other parts of this process that aren't even being touched. And I understand I'm the moderator, but I would like to make a comment about that. We knew our time was limited this evening, and we wanted to make sure that we were able to get to questions in an efficient way. I personally apologize if this wasn't the best way for you as a member, because we know one size does not fit all. So I do apologize for that. However, your questions that remain will be answered. They're not going to be tossed into the trash bin. All of the questions compiled will be answered. Cheryl, would you like to comment, or Buck?
Again, we've already decided that even after we run out of time here, if you have individual questions, please come up and ask us. We will talk to you one-on-one. We'd be happy to do that. We don't mean to make elaborate, long answers, but sometimes that's what it takes. Hopefully we have been able to communicate why we do things in as open a fashion as possible. A lot of these answers aren't black and white. A lot of times people think that testing is black and white, but at the end of the day, testing is professional judgment. And the idea is, how can you consistently make professional judgments that are fair and correct? So I apologize if the answers have been perhaps longer than you would have liked. It's not because I'm trying to hide anything, it's because I'm trying to explain as best I can how these things really work, and they're fairly complex issues.
Thanks, Buck. I'd also like to add that we have a certification specialist on site all week at the Conference Resource Center, the CRC. You probably can find more information about that in the program book. And we also, I'm kind of looking at Tina, we also have, this is recorded. This whole session is recorded. Is that on NIC News? They can click on the link to it in NIC News or on the website somewhere? Yes, as soon as it can be uploaded, this recorded session will be available to all 15,000 of our members in NIC News. So I think that's a really excellent way to communicate to. We will, as well, we will be using your questions along with questions that have already been developed by the NIC Task Force to develop an extensive FAQ, so that you can, that will also be in the link on NIC News, to click on that to get more information as well in the FAQs, frequently asked questions. So.
Thank you. Final question. The other professions spoken of are consumer-driven. Interpreting is not. If I want a specialist as a patient, I have a choice of oncologists. This is not true in most of our deaf communities. We call a doctor, they call the agency, the interpreting agency, and deaf consumer hopes that the person is qualified. Testing won't help this. A system-wide change is needed to ensure that consumers get the services needed by the most qualified rather than by the most available.
I agree. I mean, that's what this is all about, is hopefully the fact that RID is coming up with credentials that have meaning, that are understood, means that the industry who serves the deaf will be able to actually adjust and be able to say, what do you need? Okay, if the answer right now is, you need an interpreter, here's one, as opposed to, I need an interpreter that can do this or that or the other thing, okay? If the industry doesn't change, then obviously you just need to have more outreach and other activities to try to encourage those employers, the people that provide the service, to allow you to have that ability to select what you need. RID is doing its end of the deal by saying, we are telling you and warranting that the people that we credential can do this. Now we have to get the industry to allow you to select the person you want. If that's not happening today, we have to figure out how to help it happen in the future.
And it's also so subjective. I mean, our field is, it's so filled with subjectivity. An interpreter, that one deaf person would say, don't ever send this interpreter to any assignment I need an interpreter for. Another deaf person is saying that there's trust. There's so much trust involved with the use of interpreter services. And so, I mean, that's a dilemma that we face in the profession, that there's subjectivity involved and in a trust level where a deaf person would say, but I know she's not the best interpreter, but I trust her. I want her. And we deal with that in our profession too. If we could take the emotion out of our field, the emotion in our field, not only on certification issues, but the trust level of using interpreters, on the political level of making decisions for our profession. There's so much emotion built into the work we do. And how to separate that from certification. That was a great question, and I didn't answer it. I'm sorry. You're going to wrap up, Kelly?
Well, I just wanted to say thank you to everyone for submitting questions, and just say again that we will answer all of your questions. The FAQs will be out. This session will be up on the web. All of the documents in your packet and more are up now on RID.org. So please watch in the coming weeks for the pre-JTA and updates on anything new that's going on with the test, including those FAQs. And the pre-JTA will be done in ASL as well. Cheryl?
Finally, I just want to take your attention one more time to this flyer. If you take anything away from this session today, it's the timeline. Really, trust not what we're saying here in this session. Trust what you see will happen. Immediately following the conference, you're going to see the information on the website and action taken with the survey and the JTA. And finally, one more time, I'd like to thank the task force members. You saw their names earlier, and those of our members and the deaf community who worked with us on the scoring system that Buck talked about a little bit earlier, the new scoring system for the NIC, and that includes NAD President Bobby Beth Scoggins, Emily Ott, the NIC Task Force Chair Michael Canali, Stacy Storm, our Director of Interpreting Services for the conference from Gallaudet University, Coco Chino, Carrie Brewer, one of our members of the Certification Council, Len Roberson. Thank you, all of you who helped with the scoring. And thank you for coming today. I want you to know that we appreciate your questions, because the work we did with this task force is based on your concerns and questions. The further work that we do is based on the feedback that we got from you today and ongoing as members log in to NIC News on the RID website. So thank you.